everyone, I am Anita Dilip. Welcoming you all to another episode of Conceive. As we all know, we have been discussing about various infertility issues and Dr. Anita Mani was giving us a lot of solutions to the various problems faced by many of us. And let's see today what she is going to discuss. And welcome you, ma'am, to the show, please.
Thank you, Anita. I'm getting a lot of inquiries about fibroids. So I thought, shall we discuss about fibroid if you like the topic?
Yes, but I don't have much idea about this fibroids. Yes,
oh, then it's a good topic.
Yeah.
Fibroid is nothing but a small benign tumor that affects the uterus, that's the womb, and it is fairly common. So most of the women who gets older, so as they cross their 30s and 40s, they start to get this problem. Nearly 30% of women have fibroids, and we do have some issues because women with fibroids have difficulty sometimes in getting pregnant, or they can have miscarriages, they can have problems in pregnancy, they can have problems during cesarean or delivery as well. So it is quite significant when we consider fertility issue. Other than fertility issue, fibroids have sometimes can cause nasty symptoms, so that can also affect a woman's life. So we shall discuss more about fibroids.
Is there any connection between the hormonal imbalance and this
the fibroids? That is actually a misconception, because fibroid is nothing but actually a tumor. You know, we know about cancer. You know, it's like a growth.
Yeah.
So a growth can happen in any tissue of any part of the body. You know, we have heard about cancer stomach, cancer brain, cancer, you know, bone, you name it. It can happen anywhere, even in a skin, right? So that is excessive growth of a tissue is cancer. Abnormal growth is we know that it's a swelling, right? But there are two types of tumors. One is cancerous, which is highly abnormal growth in a very fast pace. The other type of tumor is called a benign tumor. So in a benign tumor, what happens is that the tissues do multiply like as in cancer, but it grows in a very small pace. So it produces a swelling because there is an overgrowth of tissue, but that growth is very slow, and it's not like an uncontrolled fast pace. And the main difference is that it doesn't usually destroy the tissue around it, or it doesn't metastasize. So like, you know, it doesn't spread to the other part of the body like a cancer. So generally the cancerous, as we know that cancer causes death, it can cause complications. The benign tumors are safe to have. It is much more common, and it doesn't produce usually any major complication, and definitely it doesn't cause death. So benign tumors are a group of growth which are not harmful for us. You can safely leave them alone. The fibroid is nothing but a benign tumor that affects the uterus. So you can have sometimes benign tumors in other parts. Saying that it is a benign and harmless, because it is actually present in the uterus and it can slowly grow, because the size of a big fibroid can cause obstruction, not because of any other harmful effect, but it can cause obstruction. So it does have a few side effects.
So this, as you said, this presence of this fibroids, how it leads to miscarriage?
Okay, when you think about miscarriage, the uterus is like a muscular globular organ, and it has a cavity inside it. So a pregnancy grows inside the cavity. So this muscular structure is very special, because uterus is one unique organ that it can grow. So, when you think about your heart or when you think about your kidneys, can it grow? No, it can't. You know, if it grows, then you have a disease. So, it cannot expand. You know, nature has made this unique property to only uterus, that it can grow. So, along with the baby, the uterus can get bigger and bigger, and we know that it gets very big. You can see that how big the tummy is for a 9-month pregnant woman. And if they are carrying twins and triplets, they can huge. So, this is a you know, a structure which will grow in a very elastic way. So, if you imagine that, like, you know, there is a space inside that. If you imagine that a fibroid is like a ball, which is, you know, if this is a cavity, it can actually push the cavity because it's like a ball. So, when the uterus grows in pregnancy, this fibroid also can grow. So, what happens is that if the baby is growing in the cavity, this fibroid can push the baby. You know, it can actually physically affect. So, you know, you don't want a stone to be kept on you, do you? Imagine. So, it is a physical effect on the baby which can actually affect the growth of the baby. That is only one aspect. The other aspect is that the uterus is a muscular organ, it needs blood circulation, and this baby is growing inside the uterus that needs nutrition through the blood circulation. Fibroid is like a greedy organ. What happens is that he takes away all the blood circulation from the baby and it grows. So, it is like a competition. Baby is growing, fibroid is growing. Sometimes what happens is that the fibroid wins. So, it takes away all the blood circulation from the baby. So, baby does not have anything to grow. So, that results in miscarriage. So, there are two reasons for miscarriage. One is the physical pushing, the second is taking away the food. So, fibroids in particular positions or in a particular big size can cause miscarriages, but some fibroids which are in a position where it does not affect physically the baby, like if it is in the outside of the uterus, we normally call it subserous fibroids. Those fibroids do not cause miscarriages. So, only certain fibroids cause miscarriage.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF.
So, early detection of this fibroids in the uterus, whether is it possible to prevent this miscarriage, if you can?
That is a very good question. See, whether the question is whether we need to deal with a fibroid before the woman gets pregnant. So, we will look at the anatomical positions of the fibroid, because we need to know that
even not before the pregnancy, even during pregnancy, early detection of the fibroid.
The fibroid. So, either in pregnancy or before pregnancy. So, there are 3 types of fibroids. Imagine again the uterus as a globular structure with a cavity. So, a fibroid can happen near the cavity. It is called submucous fibroid, which is jutting into the cavity. The other fibroid happens in the muscular layer of the this thing. It is called intramural fibroid. A third variety which happens on the covering of the uterus, its outside, is called subserous fibroid. So, there are 3 varieties. So, what happens is that many women carry fibroid without their knowledge. So, they might get pregnant without knowing that they have a fibroid. So, what happens is that they have a scan in the early pregnancy, and then the doctor says, oh, you have a fibroid now, you know, you have a 1 millimeter or 1 centimeter or 2 centimeter, they will explain to them. So then we have this dilemma, you know, what to do with the fibroid. She didn't know that there was a fibroid. The decision of what to do with the fibroid depends on the variety, which one it is, whether it is submucous, intramural or subserous. One thing. The second is the size of the fibroid. So if you have somebody who is not disturbing you, you would just leave them alone. So if you have a noisy neighbor who's not really affecting you, just leave them alone, you ignore them. So just like that, you leave the fibroid alone. If it's a subserous or intramural, which is a small one, leave it alone. You just monitor the pregnancy to see whether baby is growing all right. But if you have a fibroid near the cavity, or if it's big enough, then you have to think seriously what to do. But the problem is that generally we do not do any surgery to remove fibroid in pregnancy. So unfortunately, if you detect something which is affecting the pregnancy, you may have to wait till the end of the pregnancy. So sometimes it does happen that miscarriage might happen. But if possible, if you have detected the fibroid before pregnancy, you could plan it and you could remove it.
Doctor, how do we know that we have fibroid?
That's actually interesting question. Because, you know, as I explained earlier, fibroid is not a major disease, so it doesn't cause any symptoms. So the fact is that most of the women have fibroid without knowing that they have fibroids. So it's very difficult to detect it because you don't have symptoms. If the fibroids get bigger, and if the blood circulation gets higher, and you know, if there is too much of blood circulation, they can get symptoms like heavy periods, they can have prolonged periods,
High bleeding.
Pain is not a very common symptom, but sometimes, you know, the inner part of the tumor might degenerate because of the lack of blood circulation, and those women might have be experiencing a little bit of pain, but generally it doesn't cause any pain. And again, because it's a tumor which grows very slowly over the years, and they might be carrying for 20-30 years, it can get big enough to cause some pressure symptoms. Pressure symptoms in a way that it can press on the bladder, and you know, they might feel like having any symptoms related to urinary tract, or it might press on the bowels, which is very close to the uterus. So these symptoms are quite rare, but that can happen too. But generally, most of them are asymptomatic, other than for a bit of heavy periods, prolonged periods, it might be silent.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF.
Doctor, what are the treatment options?
Looking at the treatment options, generally most of the patients would like to know whether there are any medicines available. That's a quite common question I ask. Can it be treated by medicine? The answer is actually no, because there are no medicines available to remove a tumor as such now. But there are some injections available which can reduce the size of a fibroid for a minimal amount. But these injections are generally having a lot of side effects because they make the women postmenopausal. That is the only way to reduce the blood circulation to the fibroid and reduce the size. So generally it's not recommended. if at all needed, it is usually given just 1 month before surgery to reduce the size and vascularity. So, it is like a temporary measure. The moment you stop the injection, it is going to come back again, and it can be given only for 6 months. And making a woman go through a postmenopausal status may not be good, because there are going to be a lot of side effects. You are going to get an aged woman in a young woman. So, I wouldn't recommend that medical treatment be done for that. As such, if the fibroids are small and if it's not affecting the fertility, I would advise that they should be left alone, or just monitor them every 6 months or once a year by doing a scan to check the growth of the fibroid. And not only that, you will be able to assess the symptom of the patient to see if they have any developing symptoms, and then you can act depending on the symptoms. The major definitive treatment for fibroids would be a surgery to remove the fibroid. So, we generally call it as myomectomy. This is a medical term. So, the myomectomy can be done in 2 ways. We can do an open surgery, cut open like a cesarean and remove the fibroids, or it can be done laparoscopically. So, laparoscopic myomectomy is quite a safe procedure, and if you have multiple fibroids, like you can have 2 or 3 fibroids, you can remove all of them at the same time. Ideally, myomectomy should be done laparoscopically if they are small in size. But if you find that they are very huge, if you have a 20-30 centimeter fibroid, it might be very difficult to remove it laparoscopically. So, you may have to have an open surgery. So, if these fibroids are symptomatic, they can be removed. If the fibroids are affecting the fertility, then it can be removed. The other variety of fibroid, which is inside the cavity, it is called the submucous fibroid, needs to be removed through hysteroscopy, because it won't be able to access through a laparoscope. So, you need to pass the camera through the inside of the uterus and remove it. It is called a hysteroscopic myomectomy. So, there are various surgical treatments like that available. We do hear that a lot of patients have hysterectomy, that is a removal of the whole uterus to remove fibroids. That I personally feel and is medically probably an inappropriate surgery, because the uterus does not have to be removed to remove the fibroids. When a woman undergoes a procedure like hysterectomy, it is a major surgery. The woman is actually getting rid of almost her womanhood, because she won't be able to carry a pregnancy ever in her life after her uterus is removed. Not only that, even if the ovaries are preserved, that means the ovaries are not removed, and only if the uterus is removed, even in that circumstances, the hormones in the body tend to come down, and generally they stop ovulating in couple of months time. So, imagine a young woman in her 30s or even 40s having a uterus removed. You are forcibly making that woman go through something called menopause. It is called surgical menopause. So, going through a surgical menopause is definitely not an ideal situation unless it is really necessary, because the hormones, the female hormones, the estrogen, the progesterone, they keep the woman young and healthy. It is not only the appearance, it is not just the behavior, the hormones affect every single organ of the body, including the reproductive system, the urological symptoms, the cardiovascular symptoms, the skin, the brain. So, what happens is that the moment the estrogens and progesterones are stopped, all these symptoms, systems are affected, and the woman go through a lot of symptoms. So, imagine like a 30-year-old becoming like a 60 or 70-year-old. That is very unfair. So, my opinion is that a woman should never have a hysterectomy, that is the removal of uterus, unless it is really necessary procedure. because you find that many women have unnecessary surgery done and they suffer through the postmenopausal symptoms. These postmenopausal symptoms are much varying, and some women have even memory loss, they can have hot flushes, they generally they feel more tired, they are lethargic. Some women have mood variations, they can get depressed. So, there are a variety of symptoms. So, you can imagine that why somebody young, active, healthy would go through a procedure to get all these symptoms unnecessarily. So, it is very important to understand that fibroids are benign tumors, they are harmless, they are not cancerous, and there is no need to remove your uterus unless your symptoms are unbearable. There are surgical procedures like myomectomy to deal with it, and they are good enough to control if you feel that they are uncomfortable. If the fibroids are small, they are harmless. If you don't have symptoms, just leave them alone.
It was really an informative, thought actually you have passed to the audience.
Yeah, I really would love women to have their uterus and not it to be removed. That's the reason. So, I want people to really understand that.
I have gone through your blogs actually. You have written something about this.
Yeah, I am very interested because I do find that this message has to come across. So, I usually write blogs on every topic, and this particular topic I have written a blog purely about post-menopausal women, surgical menopausal women suffering about it. So, anybody who have doubts can go through that blog. It's Bangalore IVF Blogspot.
The impact of Conceive is the responses we receive from our audience. So, dear all, we will look more deep into other various issues related to infertility in future episodes. Thank you.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF,